learners, welcome to this MOOC on Sociology of Health and Illness. I am Maureen Kalita, Assistant Professor from the Department of Sociology, and today in this video we'll be discussing Unit 33, that is Understanding Medical Social Work, from the Module 10, which is Healthcare Institutions. So before going into the details, let's go over the learning objectives for this unit. After going through this unit, you will be able to understand the meaning of medical social work and its relevance. Then we'll go across the history of medical social work, and lastly we'll also take a glance at the challenges faced by medical social workers. In simple words, medical social work is the application and adoption of methods and philosophy of social work in the field of health and medical care. Medical social work makes selected and extended views of those aspects of social work knowledge and methods which are particularly relevant to helping persons who have health and medical problems. They are responsible in a way for integrating care with the patient's personal life and support systems, arenas that do not fall under the expertise of doctors. This means assessing the impact of all social, financial, emotional, cognitive, environmental, and any other support needs of the patient, and communicating this with the system and to the external systems such as home care, and establishing plans for continued care and well-being of the patient. Now we'll go towards the definition of medical social work. And Robert L. Barker, he defined medical social work as the social work practice that occurs in hospitals and other healthcare settings to good health, prevent illness, and aid physically ill patients and their families to resolve the social and psychological problems related to illness. Likewise, Cobalt, he defined medical social work as a process which serves to assist the caseworker in diagnosis and treatment of patient through study of the patient in his social situation and by understanding the patient in his environment. According to the Association of American Medical Colleges, medical social work is a method which is centered on one-to-one relationship, and it's a primary technique that supports in social functioning of the individuals. Now, after going through the definitions, we come to understand what is the relevance of such social work. Medical social work came into being because some doctors and nurses wanted more far-ending ways of making the sick well and keeping them well. Medical social work, a major domain of social work, is also known as the hospital social work. Now, its main function of the hospital social work was teaching the doctors and nurses about social and psychological aspects of disease and to liaison or act as a bridge between hospital and the social environment and community. The medical social workers usually work in the hospital, nursing facility, hospices, or any other clinical settings. They work with patients and their families in need of psychosocial help. And with their expertise, they can access the psychosocial functioning of the patient and families as and when needed. Intervention may include connecting patients and families to necessary resources and support in the community, thus providing them counseling and psychotherapy. So, and now we come to the nature and scope of medical social work. Medical social work is based on the assumption of the individual's dignity. It is guided and inspired by basic values and ethics of social work. According to medical social work, health refers to that state or condition in which an individual is capable to utilize all the capacities of his social living. Medical social work, this field, it considers human health with a broader perspective. Like, according to medical social workers, the treatment is not the final solution for illness, and the idea of disease and diseased person are totally different from each other. So medical social work in a way also differ from medical sciences. in medical science, the emphasis is given more on the disease and ignoring the diseased person. But the medical social work studies the diseased person as in the social aspect of the disease. They deal not only with the prevention of the disease that the patients are facing, but also their aftercare and the social rehabilitation facilities for the patients. Now, we come to the historical development of medical social work. If we talk about the history of medical social work, we can trace it back to the 1800s when social workers entered the hospital settings with different intentions and tasks. So what happened was, in the beginning, forerunner of the contemporary hospitals was almshouse, which was basically to serve the poor and needy, as well as ill persons, orphans, and aid in their mental health. This was due to the huge immigration happening in the United States during that time, and medical care was initially considered supplementary. During this time, medical social workers were known as almoners, which bear the charitable concept of the almshouse. Later, Mary Richmond, she made a significant contribution to social casework. Mary Richmond used the word social diagnosis in her book, which was published in 1877. This work may be considered as the first book in social casework. So in the history, this is considered an epic juncture to the beginning of medical social work. It set forth the methodology of helping client through systematic way of assessing their problems as well as handling them. In the 1890s, in London, on the initiative of Charles S. Locke, medical social workers, they worked as volunteer greeter in hospitals. They used to make social investigations and decide whether to admit the patient for free treatment in the hospital or ask them for community organizations for financial support of the patient. Many doctors and medical personnel then recognized the importance of not just treating patients physically or psychologically, but also taking care of patients' social needs. Tuberculosis, syphilis, polio, and pregnancies of unmarried women were conditions that required the need of a person to take care of their social need. Also, in case of diseases like tuberculosis and syphilis, a long hospitalization period and aftercare is also required. So in USA, social work in the healthcare began at the Massachusetts General Hospital, MGH, in the early 1900s. And at this time, the health workers and physicians realized that living conditions and personal problem of the patient played a major role in their illness and recovery. Dr. Richard Cabot, who was the chief of medicine in MGH, he helped on establishing social work in hospitals and appointed a nurse to take care of all the responsibilities. Social work in healthcare was eventually divided into medical and psychiatric social work, a division stimulated by the introduction of the Freudian psychoanalytic theory around the 1920s. Since 1905, in hospital setting, medical social work in the healthcare field has extended to various healthcare settings like community-based clinics, nursing homes, psychiatric and other hospitals, public health agencies, rehabilitation centers, home care agencies, and private medical practices. American Association of Medical Social Workers and American Hospital Association, they also published major studies of medical social practice in the form of pamphlets and books in the period from 1925 through 1940s. Although the most striking characteristics of the casework literature of this period was its growing recognition of psychodynamics, but it is unfortunately true that the major parts of such writing tends to be descriptive rather than analytical. This is one of the challenges which is faced on because of the literature and the type of work the studies did in those literature. The literature on casework in medical setting is filled with articles that describe in detail the work of the writer in few cases or his experience in specific kinds of emergencies, and such articles offer generalization regarding the range of social needs which reveal little of treatment's method or diagnostic thinking. Now, we come to the historical development of medical social work in the context of India. So, in India, what happened? In 1936, Dr. Clifford Manshart, an American missionary, started a formal training social work program in India through Dorabji Tata Graduate School of Social Work. In 1946, the first medical social worker was appointed in JJ Hospital, Bombay. From 1960s onwards, the scope of medical social workers have been increasing in India. Today, almost the majority of teaching institutions, both in arts and the sciences and medical university, they have a postgraduate course on social work. Tata Institute of Social Sciences, this is the pioneering institute in India in this field. The following points now will help us in understanding this course and development of social work in India. So in 1936, the Child Guidance Clinic was set up in Bombay. Then in 1937, the following year, Tata Institute of Social Science started graduate courses in social work. And then in 1938, a full-time social worker was employed in the company to look after the well-being of the employees as well as neighborhood. In 1939, TB Association sent a group of students and volunteers for training in this, and this was the milestone and in the beginning of the medical social work discipline. In 1947, Government of India appointed Bhore Committee where they submitted the report, and the following year for a training program of 2.5 years, and that training program was recognized. Then, in 1948, Yarwara Mental Hospital was established for poor and gravely affected mentally ill patients. In 1955, the first medical and psychiatric social worker was employed by Child Guidance Clinic College of Nursing, which was run by the Ministry of Health. And then in 1959, in JJ Hospital, MSW Medical Social Work was appointed in the psychiatric department. So this was in brief the history and the context of medical social work or social work in general in India. After going through the history, we now come to the challenges which are faced in this field. Medical social workers serve as navigators for clients seeking services within the healthcare system and community at large. One major factor that distinguishes medical social workers from other social work fields is the fast-paced environment of the healthcare setting. It requires medical social workers to engage with their clients, build a trusting relationship with them, and assess the situation along with providing appropriate information, validating the client's thoughts and feelings, and at the same time also gently challenging the client's views and actions. And lastly, they also counsel clients in a short amount of time and within a limited number of meetings. Medical social work, being the third most practiced area of social work, is becoming a growing concern for the effects of burnout, as their clientele are growing in severity and their caseloads, paperwork, and wait lists for services are increasing. The term burnout refers to a prolonged response to chronic workplace stresses characterized by three dimensions: emotional exhaustion, a feeling of disconnect to oneself, and inefficiency. This burnout can lead to negative psychological, physical, and health effects. In their study, various scholars they found that burnout can lead to symptoms of depression and anxiety, and can lead to sleep disturbance, impairment in memory, and pain in the neck and back area. In addition to the psychological and physical effects, burnout can also lead to health problems such as respiratory infections, recurrent headaches, and digestive problems, which can affect the total well-being of a person. So in the field of social work, burnout is commonly experienced due to the frequent intensive interactions they have to have with their clients and the high demand of their services. The current research that exists regarding burnout and healthcare providers emphasizes burnout among physicians and nurses. And the scholars, they have found that among the healthcare providers such as physicians and nurses, burnout rates are high. This is due to the constant high level of stress in the workplace, and because of that, the high rates of burnout among the healthcare providers, it can result in negative effect on patient care and their medical personnel. Schanfeld and others, they found in their study a strong correlation between major medical errors and burnout in surgeons. Another study on the nurses' shift length and patient assessment of care found that there was a strong relationship between the longer the nurse's shift is in the work, and it had some relation, a very strong relation, to the lower patient's satisfactory rate of the care that they provide. With medical social workers working in interdisciplinary teams alongside physicians and nurses, there is also a need for attention to the factors that can potentially lead to medical social workers and their burnout in the work. Some research and findings have major implications for social work practices. At the macro level, the findings can contribute to the implementation of interventions and strategies or policies within the healthcare settings to prevent such burnouts among medical social workers. And at the micro level, the findings create a better understanding of the importance of self-care, which can ultimately result in lower burnout rates and better quality of service. In addition, the findings in regard to preventing burnout assist medical social workers in upholding the NASW Code of Ethics, values of service, integrity, and competence. NASW, the full form is National Association of Social Workers. And apart from this burnout issues, there are few other major challenges that were identified, and these are the organizational challenges, insensitive policies, inadequate staffing of social workers, and heavy caseloads. It can thus be inferred that social work is not well understood and valued in the medical field, as policies go against the social work values and the organization does not see the need and the problems they are facing in the field. Another major theme which was identified were the challenges faced by the medical social workers while working in interdisciplinary teams. Major challenges associated with working in interdisciplinary team include each profession having different views and approaches on how to help a patient. This finding suggests that other professions view the patient as primarily the illness that brought them into the hospital rather than viewing the person as a whole, which the medical social worker looks into in their case. And this implies that social workers are constantly needing to advocate for their patients, which can be a challenge in the medical field where there is a clearly difference in hierarchy. Additionally, the medical team's lack of understanding of the social work role can be challenging in this profession. The medical social workers have to deal with things that are out of their scope of practice or expertise. Also, learning the medical aspects such as learning diagnosis and medical terminology can also be another challenging situation. And this is a unique challenge experienced by medical social workers as they do not receive the same education doctors and nurses do. Obviously, their field of study will be different, so their knowledge and the expertise in the level of healthcare will also be different. but then also they are expected to be familiar with the medical aspects of the patients, which can be a little difficult for the medical social workers. So these are some of the challenges that the medical social workers face in their profession, which needs to be taken account of. And with this, we come to the end of this unit. Thank you, learners.